We talked about this last week.
Yep.
Joe Montana is now going to be the WellCare spokesperson.
Yep.
Believe it or not. So anybody who is damning Joe Namath, you got another Joe in your ranks to talk about. We're already
At least
hearing a ton
he's
about
with
it,
a
though.
carrier and not some random. I can
mean,
respect
Joe
the
Namath
carrier
is
doing
like
it.
is like a lead vendor.
Yeah, it's like the Medicare helpline, which is a generic. I don't know who I'm calling. At least if WellCare, United Healthcare, Humana, Cigna, they're at least, I would say, reputable companies. So when they get spokespeople, you know exactly what they're talking about. Where Joe Namath is just hey, call this random number and maybe you'll get something, maybe you won't.
I don't know. Your guess is as good as mine.
Yeah. And that scares me, but most obviously it works because he's still there.
Everything scares me.
Yes.
So good morning, everybody. Good morning and welcome to the Medicare Cafe. Whenever this is the last one before AEP marketing begins, which is terrifying. We have 3 months until 2022. We only have 3 days until AEP marketing begins. So welcome. Hopefully this doesn't freak everybody out. For those of you who don't know us, we are your hosts, Olivia Richardson.
Now, Mike, and today we're talking about one of my biggest pet peeves in this industry is the AEP sales illusion. When all these agents talk about how they're going to get 8,000 sales in AEP, then you look at the numbers like you didn't really get 8,000 sales.
Oh, that was a little dramatic.
Yes, it was, because everyone's goals in AEP are to service current clients, add new clients, gain referrals, and just plain survive. But when it comes to adding new clients and gaining referrals, I think that's where ego comes into play.
Oh, there's so much ego when it comes to AEP because a lot of us, what the numbers used to mean is that realistically 70% of our business was done in the last 3 months of the year, the last quarter of the year. We're now seeing that being very different. It's now because of SEP, IEPs. A lot of people are aging on and choosing a Medicare Advantage at first.
Right.
So we're seeing that being more spread out, but it's still, again, the last quarter of the year is where these numbers get beefed up, but some people over beef, if you know what I mean.
Yeah, because even 100 sales a day is almost 2 sales a day because it's 54 days.
100 sales a day is 2
No, 100 sales in AEP, sorry, is 2 sales a day. That sounds better.
I'm not a mathematician, but something seems off here.
I'm very off. You should know that by now. But I've seen people boast numbers 200, 300, and you're talking to almost 6 sales every single day during AEP, which, you gotta remember, we have several weekends. We have a holiday in there. Well, we have a couple holidays.
We have several.
You have Halloween, you have Thanksgiving, you have Pearl Harbor Day, which isn't celebrated so much, but that's the last day of AEP. But it's how do agents do it? And they do it by overinflating their numbers for most of them.
You really think so?
I think so because, as you can see, a lot of them will count their current clients who already have plans with them. If they switch them, that's a new sale. When it's not really a new sale,
no, that's such a good point.
Same amount. You don't actually earn any more money by changing clients over.
Oh, it's actually costs you money because
Veterans
you're not.
Day's in there. Thank you, Bernadette.
November 11th, right? Isn't November 11th Veterans Day? But that's such an amazing point because when you actually rewrite a current client, you're losing money because that's an appointment that could have gone to somebody new. When you rewrite a current client, you're taking money from your left pocket and putting into your right.
Right.
So servicing an existing book of business, though it does help you with referrals, though it does help you with retention, it's not new money to you.
Yeah, and as you can see, if you have 100 clients, and 80 are current clients and 20 are new clients, so you get 100 sales in AEP.
I don't like all these numbers. I didn't come here for this. No, keep going. This is good stuff.
10%, which is 20 people at $270, that's $2,700. So you may only add $2,700 to your bottom line, but most agents will say, no, I had 100 sales and I earned $27,000 in AEP by selling 100 policies. No, you earned $2,700. You maintain $24,300. That was already there. And so I think these are numbers that agents use to recruit other agents. Like, look, I had 100 sales in AEP. I could train you how to do it. And you're like, no, you had 10 sales in AEP or 20 sales in AEP. That's it.
I think it's like,
and I added those numbers wrong.
Turning in a policy isn't necessarily
$4,200 actually. Sorry.
42. Okay.
Yeah.
Good stuff, Mike. Good stuff.
It's still less than $5,000 compared to $27,000.
Turning in a policy, I guess, is just different. What are you considering sales? Are you considering servicing your book of business a sale? Turning in an application, is that a sale? Or is that, again, servicing? I know for us personally, because we don't get to see as an FMO, senior marketing specialist, we don't get to see names of clients. We don't get any of that information. All we get to actually see is how many applications did you submit with a carrier through us. So we were working with one of our top agents. They sit on our advisory council, and was talking to them about like, hey, they had a killer year. They were saying like, your United Healthcare business like quadrupled over the last 4 years. The production, the literally hundreds of thousands of dollars in production during AEP, and we were literally ready to go to his office and celebrate and pop the champagne. He's like, what are you talking about? I had a terrible year. All I had time to was roll over in this case, it was all I had time for was to roll my Aetna business to United Healthcare. I didn't have any sales. And it was for us, that's like a light bulb went off in me, and it was just like, oh, yeah, seeing production and seeing app count doesn't even begin to tell the whole story.
I fixed the slide while you're talking.
You weren't even.
But I was listening. No, I was listening because you're right. It's like they even said, yeah, I might have had all these new sales for this carrier, but if you look at their book of business, it stayed
no new clients. And to him, he said, I had a horrible AEP. I added no new clients. I had no time. I just rolled my whole business.
Yeah. So basically, if he had 100 sales at 27,000, he just took 27,000 here, put 27,000 here. But it took him how many appointments, how much time to maintain that business. And that's the point. Part of the point is you still have to maintain your book of business.
Yeah.
Like, you don't want them to roll over to somebody else.
No, because again, like we talked about with Joe Namath, now Joe Montana, there's so many messages out there telling people to call a 1-800 number, to call Medicare. There's so many messages out there telling people to shop that if you're not servicing it, just assume they're leaving you. Like just saying like, oh, I don't need to work with these people this year, or even looking at your Med Sup business. They're on Med Sup. This doesn't affect them. Don't worry about it. That business isn't safe. You have to assume if they don't at least hear from me, they're no longer going to be a client after this year's AEP.
And that's one thing. We used to do AEP surveys, I forgot to do one this year. We'll do a post one, say everyone did. But in the post AEP surveys we've done in the past, we've seen where agents like, yeah, I had all the sales like this, but new clients were here. Every single year was like that because there's so much maintenance in this business that you have to do that. Yeah, so.
And that's such a great point too. Michael mentioned about these health assessments right now, because we all know that during AEP we actually don't get a penny of our commissions until after January 1.
Right.
Which is, a hard time of year. You have family things, Thanksgiving, Christmas. It's not a good time of year to not get paid. So it's a great reminder to use programs like United Healthcare's Health Risk Assessment, Aetna's value-based enrollment. Humana has one that has up to $70 or $75 per application, as long as your client completes less than a 5-minute phone call answering a couple health questions. Those payments come immediately. It's a great way to make sure you're maintaining an income all throughout AEP.
Yeah, thanks for bringing that, Michael. And you're absolutely right. It's take advantage of anything that you could do, because I know some carriers, are any carriers doing EAP bonuses?
I mean, that's what these essentially
yeah. So any of those bonuses that the carriers come up with, definitely take advantage of those. Even if you don't like them, it's probably going to happen anyway. A lot of times the carriers will reach out to new clients just to get a health assessment.
Right.
And if it's going to happen almost anyway, you might as well get paid for it if they're willing to throw you some money.
A lot of our agents we looked at, there was a couple of agents that during AEP alone missed out on over $20,000 worth of income just because they didn't, and they used Lean, they used Ascend, they just didn't do the health risk assessment. Now just keep in mind, if you are individually using Medicare Center through Medicare app does allow some HRA, some BBE, not through UHC or Aetna, but some other carriers, they are allowing that to happen and take place through Medicare Center. If you're going to be writing United Healthcare and Aetna, use Ascend, use Lean, get your extra income from that. Still shop and compare using Medicare Center, but enroll via Lean and Ascend to get that extra dollars.
If you're minimizing your enrollment, you're minimizing your relationship. Because if you don't tell me this is going to happen, it happens anyway, I may not be upset with you that you didn't tell me it didn't happen. But if I knew it was going to happen, if you're being proactive with me, that shows me that you're truly invested in my enrollment, and that you're on my side of the proverbial table. So tell your clients, hey, this is what's going to happen after return this application. It's going to work like this. Now, the other side of this is your closing ratio. With these new clients you bring on, a lot of agents focus on sales, they don't focus on appointments. And this is where your closing ratio really comes into play, because with new clients, on average, the financial industry as a whole has a 19% close ratio. And that's financial. I'm sure that includes banks, financial planners, insurance agents. So I did like a 5 to 20%, which means, you know, at 15%, you're going to need 133 appointments to get 20 sales.
And this is with brand new people, not current. Yes. This is 133 appointments with people who do not currently have a policy with you.
Now, as you can see on their current clients referrals, much higher closing rate because they already know you or they know somebody that used you, and there's that trust factor already built in. But still, not everyone's going to change plans. Some people maybe just stick their heels in the ground, say, nope, I'm not moving, or maybe that situation doesn't allow them to.
So Mike, what would your recommendation? Because here we're talking about, again, this year we're very fortunate during this AEP. The market is extremely stable.
Yes.
United Healthcare is going to have another killer year. No mass exits in the market. A lot of companies who were competitive last year just beefed up their benefits. The ones who were less competitive continue to beef up. So not a lot of shakeup this year. That being said, how would you recommend, if you are working with somebody, how do you recommend to either shorten, and I don't want to use the word eliminate, because some people genuinely want to meet with their agent during AEP,
right.
But how would you kind of streamline your appointment process during AEP?
What I've seen myself and what I've seen other agents do is they hit the highlights. So rather than walk them through the whole policy, they'll say, here are the top 3 things that change. So pick the top 3 things, whether it be co-pays, benefits, value-add services.
The current client and they're staying on the same plan.
Yeah. So, hey, Martha, you're saying, you know, your plan will roll into next year with, you don't do anything. Here are the top 3 things that change. Bam, bam, bam. Do you have any questions? No. Just so you know, there are about, and then you go right into, you know, the cross-selling opportunity. So, but I would just take 3. People like 3. You know, it's easy to grasp. It's easy to remember. You don't have to go through every change because you got the evident the
ANOC.
ANOC, thank you.
Notice of change.
Too many damn acronyms.
There's a lot.
Yes, but they got the ANOC, and I would just say pick the big 3 that changed. Ask them if they have any other questions, and then talk about the limitations of the policy.
Sure.
Say, hey, one thing we're still seeing roll into next year is that chemotherapy is a real weak point. Are you concerned about that? Well, yeah, I don't want, if I get cancer, I want to make sure I'm taken care of. Okay, well, a lot of my clients are choosing to beef up their benefits with a cancer benefit added on their policy. It looks like this, and now you go right into a cancer.
Yeah, that's a great point. If you're going to have to sit down with somebody who is a current client, and if they're not moving, make the most out of that appointment. Give them out hospital indemnity plan, the cancer insurance, making sure you're talking to them about their other opportunities. That's a really great point. Just a reminder that if you are switching a person on a plan, maybe you're taking them from a Humana to United Healthcare, just a reminder with that, that you do have to go through the full benefits, the summary benefits. You do have to outline everything with them, even if they are a current client. That still is what is required to do a compliance sale for Medicare Advantage or prescription drug plans. I think too is making sure you're using streamlined services. So again, I'm going to talk about Medicare Center because Medicare Center really is a great tool to help you process and streamline things. Remember, you can send a client their profile prior to the appointment so they can update their own drug lists. If you have somebody that has a mymedicare.gov account, you can use the blue button technology and automatically import their prescriptions. You can send people, if you're seeing somebody you don't want to meet with them face to face, maybe you're just comparing the drugs, you can email them or text them the application, just the signature pages, and get them to enroll themselves without actually requiring a face-to-face appointment. Medicare Center does a lot to help you streamline, especially if you're working with somebody that doesn't require the maintenance that a new client would require, somebody that just wants to check it off, the convenience, somebody who really values convenience. Medicare Center streamlines all of that for you as the agent.
Yeah, and definitely streamlining everything, because I would say when you walk into a summary of benefits, what I always say is I'm gonna roll through these co-payments and co-insurances. If you have any questions, stop me. Otherwise, we're just gonna push right through it, because you don't want to start diving into a hospital inpatient deductible or co-insurance when the customer doesn't care or the client doesn't care. So
well, again, if it's a new plan that you're writing, you have to go through it, but you can do so very quickly. Terry mentioned HealthNet in California eliminated a lot of coverage for small businesses. Do you have sample ads to find this business? So Medicare, the AEP toolkit does have a ton of advertising, a ton of stuff. The best thing for things like that would be to send out letters and to send out postcards, create flyers for things like that. We're more than happy to look over that on a compliance standpoint. But again, call our office, call and talk to our agent resources team. They'll be more than happy to help you come up with a way to capitalize, because that's a huge opportunity. They'll help you find ways to capitalize on that opportunity.
Yeah, and definitely when it comes to small businesses, there's that gray market, kind of like the 60 to 64 is a gray market for Medicare. Small businesses that have anywhere from 1 to maybe 50 employees, a lot of big brokerages, your big health brokerages don't mess with that. Your group brokerages, that's what I'm trying to say. So there's a good market there. If you want to start writing small business, that's a little sweet spot for a lot of independent insurance agents, is that they go after what they call micro businesses. So if you're looking to do that, I know I've never built a micro business app, but we're definitely open to learn.
Absolutely. Bernadette asked an amazing question. She said, in regards to the blue button technology associated with Medicare Center, does it require them to have to give you access to their username and password? No, you do not. They do not have to give you anything. All they need to do is you just send them through Medicare Center. You type in their email account associated with their mymedicare.gov account, and it'll have them an email. It'll send them an email basically saying, do you give, Bernadette permission to look at your blue button information? They click yes, and it automatically uploads that into Medicare app.
It's kind of like, I'm a bastardize this, or excuse me, it's kind of like when you use Apple Calendar and Google Calendar, you give each other permission to talk to each other. It's basically the same concept. You don't have to retype in your passwords. You just say, hey, I'm the owner of this, I own this, I want them to talk.
Yeah, the system just shoots the client an email. The client just says yes, I give them permission, and it's done from there. It's so simple. Of course, you want to confirm the medications are correct. The problem with blue button technology is that it does utilize the recent claims made. So if they get like a one-off medication, that one-off medication is going to show up on their drug list. Not always necessary to keep on there. So just always confirm the information is correct, but it really does, especially if you're working with a client that takes like 15 medications, we'll take the appointment from an hour to like 20 minutes.
Myrtle, the medication's not Skittles. Slow down.
Slow down, Myrtle. Great.
Yes. So that's everything. I mean, again, I would say just watch. If you are watching some of these agents boast these huge numbers in AEP, just remember that more than likely, most of those big numbers, they're just rolling business.
Well, honestly, who cares? You got to make sure you take care of you. At the end of the day, you are a small business. Printing off your insurance license and seeing people, you need to treat yourself like a small business. What is your profitability per presentation? The only way you build that is to lower client acquisition costs and raise profit per presentation by adding more products. What is your profit per presentation average? What's your closing ratio? What is your new business to existing business? What's your retention plan? All of these are questions that you need to ask yourself as a business owner. If Bob Gary from Tennessee is posting on Facebook that he's made 700 sales in a week, let Bob do Bob. You need to make sure you're paying all the attention to what's going to help your business thrive.
It's kind of like call centers. They boast on, they always talk about how much they sell, but you don't see how much it costs them to get those sales.
That's so
where they're not seeing any profitability about year 2 or 3. So yeah, they have 1,000 sales a month, but it costs them hundreds of thousands of dollars to get there. And so if that person leaves within the first couple of years, they actually lost money. So big numbers also require big investments behind them.
So keep in mind, during AEP Medicare Cafe Week, we're still here every Tuesday, 10 a.m. We do keep them pretty short because we do want to be conscious of your time. Also, stay up to date on our Facebook group. We're going to be having and Facebook page. We're going to be having different giveaways going on, different contests. Mike and I typically try to do a pie in the face contest, things like that. So stay up to date with us. Our goal is to help keep you productive, but also help keep you sane during AEP. We're going to continue to do that all through this last quarter.
Now, Bernadette brings up a good point. She says, I called the local SHIP, which is the state health insurance program where volunteers can help people with their Medicare in our area. And they enroll people into plans, but are not licensed insurance agents. How can they do that? They do it as volunteers. So anyone can enroll anyone to a Medicare plan as a volunteer, as long as there's no compensation.
Yes.
So they're not the age, they have no skin in the game. If they enrolled the person in the wrong plan, there's no recourse. Like I can't, if Olivia enrolls me into the wrong Medicare plan, I can't go to her and say, you did it wrong. She's just like, oh, well, I'm just a volunteer, sorry. And that's the end of it.
Yeah, they don't have access to Jarvis. They don't have access to Ascend. What they typically do is actually enroll people through mymedicare.gov, and they enroll people using the medicare.gov platform.
Right.
They don't have access to the carrier-specific information. All the access that they have is public information. Stuff that you can find on medicare.gov is what they have access to. Is it better for the clients? Absolutely not. It's the same thing we talked about with navigators back whenever the ACA came out. Navigators are people, they were not insurance agents, but they help people navigate through healthcare.gov, and it's the same thing, just specific to the Medicare market.
Yeah, I always tell my clients, I don't want my health decisions to be made by volunteers. I want it to be made by professionals.
Somebody who has skin in the game, somebody who I genuinely can sue if something goes wrong, you know?
Yeah, or knows what they're talking about. That may be a volunteer today and say, forget tomorrow, and they're long gone. And now I'm left with the decision that they got to me in with no recourse whatsoever.
Absolutely.
So if you want professional service, hire professionals.
Mm-hmm.
Yeah, Michelle said, good for Bob. I'm going to take care of my clients and my family.
Absolutely.
Yes.
Again, I genuinely believe, you know, back, I was a sales summit about 2 years ago. I did a presentation called Love Your Competition. And it is something that, and what it comes down to is Gary Bob, whoever he said, is not your competition.
No.
He's somebody, technically, he is an agent that's gunning for the same clients for years. But what your real competition is, Joe Namath, is Joe Montana, call centers, is the unseen, the convenience-based enrollment. That's your competition. I only have so much energy in the day. Do I want to waste it worrying about what Bob's doing, or do I want to invest it in things that'll actually make a difference and at the end of the day help my clients and help my bank account?
Bam. Moral of the story. There it is.
Yeah.
Yeah, so any other questions, comments, concerns, threats, promises, throw them in there. Don't forget to check out the Medicare Cafe agent group. We put some images on there that you could use on your social media all throughout AEP. So make sure you go in that group, download those, and use them to your heart's content.
Make sure you check out smsteam.net. Click on the events tab, that's Senior Marketing Specialist websites and upcoming webinars. We have a lot going on in Q4. Typically Q4, training and education needs to kind of take a break and prep for Q1. Got a lot going on, including how to avoid the November lull. So that webinar will be coming out at the end of October. Got a lot going on, guys. If you have questions, make sure you call Senior Marketing Specialist. More than happy. We have tons of trained experts to help you guys out.
Now, Greg asked a great question, How does the Medicare Part B premium rebate work, where plans actually give back money to clients who are enrolled?
Yeah, they're known as the Part B givebacks. The way that works is if you're enrolling in a certain plan that offers a Part B giveback, essentially it just depends on how that client's currently paying for Medicare Part B. Essentially, they'll just get less money taken out of their Social Security account each pay period. So they have like $120 Part B payback, instead of them paying $148 or $150 something.
Somewhere in there, yeah.
They'll be that minus that 120. So they'll just get $148.50. So they would just get, instead of having $148.50 taking out of their Social Security, they would just have $28.50. It just subtracts. It's not like they receive a physical check. They just subtracts from the income coming out of their Social Security.
Look for that. If you go to the Medicare Cafe agent group, there, look for that image. There's a link right there in the blue or whatever color yours is going to be, and it goes right to all, I think, 10 images that you can download. So again, that's in the Medicare Cafe agent group on Facebook.
Belinda mentioned it doesn't work for people who are not receiving Social Securities. It takes about 3 months to get the first payment back to the client, and it's the Social Security that handles that part of the aspect of the Part B give back.
Yes.
It's all done behind the scenes between Social Security and the client. If the client is not currently taking out Social Security and they are doing and paying on a quarterly basis, then yes, it is. Again, it does. They just get billed 3 months at a time less. So it still works if they are currently not receiving Social Security. It's just, again, when somebody isn't receiving Social Security, they get billed Medicare Part B on a quarterly basis. So then that refund shows up in that billing on a quarterly basis.
When stuff like that's supposed to happen, I've always told my clients, in theory, this happens, because you don't want to say it definitely will happen, because if it doesn't, guess what? Now you just lie to them, even though it's out of your control.
Yeah, you say, if this doesn't work, call me. We'll get it resolved. If that's the way that it's supposed to work, and that's the way that it's advertised, and it doesn't work like that for a client. Do the thing that agents are supposed to do. Fix it. And that's, again, how that servicing your book of business is a great way to get referrals, and of course it works for retention.
Yeah, the insurance company gives back the money, and they do that because, remember, the insurance company gets a bundle of money every month per member per month. PM. And they have to spend that money. And if they don't, they give it back to CMS. So rather than give it back to CMS, they'll say, hey, we'll actually take some of this money and give it back to our clients to show that we spent it on benefits and value-added services as opposed to just keeping it as profit.
So yeah, how do they do it? CMS gives the money, the carriers pay for that Part B payback. It's a benefit, just like the gym memberships, travel benefits, over-the-counter medications. CMS is ultimately paying for that through the carrier.
Yeah, I always tell my clients, you already paid for all this, working your whole life. Let's get some back.
Yeah, make the most out of your Medicare benefits.
Yes.
Find a plan that fits your lifestyle and your wallet.
Yeah.